Talking about today is we're going to continue the talk about anxiety. Where I left off yesterday, we had gone over what it is, how it's manifested in terms of how you think. You start thinking, you get these worry thoughts, and then it turns into a physical symptom of some sort, and then it will actually change your behavior, especially if it goes on long term. So I am the kind of person I wants to know. I want to know why. I mean, who goes to the doctor and says, you have anxiety, and then you go, oh, okay. I'm the kind of person, I want to know why I have anxiety. What is going on that is causing this? So, your brain, when you start having anxiety, it's like playing this never ending game of what if? What if I fail this test? What if I can't find my way home? What if that sound is a burglar trying to break in? The anxious brain is constantly on the lookout for potential threats, which leads to those pretty uncomfortable physical symptoms we talked about before, like your racing heart and your sweaty palms. But what's actually going on in the brain when anxiety starts? So it all starts in this little bitty, tiny, itty bitty organ called the amygdala. It's responsible for producing emotions like fear and anxiety, but also pleasure and anger. The amygdala lies really deep inside the brain. It's very small in structure, but the amygdala senses a threat, it's able to send out this alarm system to the rest of the brain. This triggers the release of stress hormones like adrenaline, which increases heart rate and blood pressure. And then the thalamus kicks into gear, sending out signals to the body that it's time to prepare for fight or flight. All of these changes can make a person feel pretty darn anxious. So that's just a brief, good grief. That's skimming the surface of what's actually going on in the brain. But let's just say, what if there is not anything going on in the brain? You have anxiety. What if there's an underlying cause for that? So when you go to your provider and they're going to say you got anxiety, you want to make sure that that provider is searching for an underlying cause. You should have some labs done. Those labs include a CBC, which is a complete blood count, and that's going to rule out anemia or anything else wrong with your bloodline. You should have a CMP, which is a complete metabolic panel. That's going to check kidney function, liver function, sugar, and electrolytes. You should have thyroid function testing done. So, one perfect example of somebody who can have anxiety because of a biological reason, a physiological reason, is the person with Hashimoto's thyroiditis. It's a perfect example of how a person can have anxiety that's driven by a metabolic problem. And the problem with most providers is they don't test for that. They'll test your TSH and your free T4, and if those things are normal, they're like, well, your thyroid's normal, but it may not be normal. So you got to push them to do other lab tests. You have to have other pieces of your thyroid lab test checked to make sure that it's not Hashimoto's. You need a urinalysis. You need to make sure there's no infection, especially if you're old. So, elderly people don't always have the ability to tell when they have to go to the bathroom, or maybe they leak a lot or they're incontinent or something like that. They can get a urinary tract infection. That can become septic just like that, especially in the elderly, and that can cause anxiety and a change actually in mentation. So, you want to make sure that you've got your urinalysis, your regular urine checked. Another thing that you might need to have done, depends on your lifestyle, but you might need a urine drug screen because some abusable medications like cocaine or methamphetamines can definitely cause anxiety. These are routine tests for sure, just going into your provider's office. But if you're in the emergency room because you were taken in by somebody because they think you're having a heart attack, they're going to look at more complicated tests. Like they might do an EEG on your brain. They might do a CT scan of the brain or an MRI of the brain. So that's the sort of workup. Usually anxiety is just a clinical diagnosis, but you want to make sure there's nothing underlying going on. So those labs, those basic labs need to be done. So the mainstay of treatment for anxiety is the first one is cognitive behavioral therapy, which is CBT, psychotherapy, or counseling. These are all similar, but finding a good therapist can really be challenging. There are many types of therapists, ranging from Christian therapists to secular therapists. There are therapists that do only talk therapy, and there are those that are able to diagnose, and they can also recommend classes of medications. The mainstay for pharmaceuticals in the setting of anxiety are the antidepressants. Now, most people will say, I'm not depressed. Why are you giving me an antidepressant when the problem is anxiety? Well, it's because they both work. The depression and the anxiety are both treated with the very same class of medications. So, the neurotransmitters that we're trying to address in the setting of anxiety or depression are serotonin, dopamine, norepinephrine, and GABA. So the adjustment in neurotransmitters helps both of those issues, and so those drugs are used interchangeably. There are several classes of meds, including your older antidepressants, which are called TCAs or tricyclic antidepressants, and these are pretty much not used so much for treating anxiety and depression anymore. They're more used kind of off label because the side effect of using those medications would knock you out. So they're also used as a sleep aid. SSRIs, which are serotonin reuptake inhibitors, like Prozac or Zoloft, are very common medications used for anxiety and depression. And then there are also newer medications that increase GABA, newer medications that will bind to 5-HTP A receptors and such like that. And those are Vraylar and just maybe not Vraylar. I think that's bipolar. But anyway, another medication that's been commonly prescribed for years and years, but has recently had a prescribing change by the DEA, are the benzodiazepines. And these are medications like Ativan, Xanax, and Klonopin. These are very habit forming, and research is showing the long-term use of these medications has been connected to early onset Alzheimer's disease. So that is not something that you want. The young lady I had 2 days ago, she was asking for that, and I didn't give it to her. So I told her, I'm sorry, I can't. You're too young. It's no. And she was pretty upset. But anyway, a medication that's very, very, very similar to the benzodiazepines is a non-benzodiazepine medication called buspirone. That's the generic name. Buspar is the name brand name. And so it acts like the benzodiazepines, but it does not have the potential for dependency and addiction. Another medication that we use for treating anxiety that's used off-label is a blood pressure medicine. So it's a beta blocker, and it's propranolol or Inderal, but it's used for anxiety. A lot of people will take medications like this or Toprol if they have to do public speaking, because that's the number one fear of most Americans that causes a great deal of anxiety if you've got to get up and speak in front of somebody that you don't know and make a delivery that you're uncomfortable with or whatever. So you take this beta blocker, it calms everything down, and it's used that way. So some other more non-traditional approaches would be something called TMS. So this is a form of treatment that uses magnetic coils to activate neural or neuron networks in the brain in target areas of the brain. So it goes like on the head here, and it will just kind of pulsate with a magnet. It's about a 20-minute treatment in your provider's office. It's actually repeated over a very long period of time. So it's an extended period of time. We're talking months. And this will address treatment-resistant anxiety, depression, and other mood disorders. Another treatment is called neurofeedback, and this is another non-invasive form of therapy. It measures a person's brain waves and gives the recipient real-time information about how the brain is functioning. The goal is to help the patient gain voluntary control over functions in the body, such as rapid heart rate, thoughts that you're having, anxious thoughts that you're having, etc. It teaches you self-control of brain functions by showing how the brain reacts to certain triggers. So with multiple treatments, a person can soon recognize the triggers that lead to anxiety, and they recreate the desired state that they want using neurofeedback. So instead of feeling anxious, having a fast heart rate, and feeling sweaty, the desired result can be relaxation and recognition of the anxiety triggers and how to avoid the progression of anxiety. Another really good one, and I've talked about this before, is your sound frequency therapies like the Wave Watch. And this can address multiple mood disorders. Let me grab mine and show you. This watch, it's got 850 different diagnoses in it. So you can just go on here and like, I accidentally hit cancer. And for some reason I can't back out. Let's see. Here we go. Emotions. So there's a whole section here on emotions. There's depression, emotional balance. There's anxiety. There's PTSD, schizophrenia. There's just loaded. It's loaded with different diagnoses. You just click on the one that you want. It emits this little sound. I don't know if you can hear it or not. But it's a sound frequency, and more research is coming out about how our bodies respond to sound frequency. Now, I have this watch available. You can get this through my link, and if you do that, you will save $100 on that watch. You can also become an affiliate if you want to do it that way. So, and that's what I'm doing here. So it's a win-win all the way. Another thing you can do for helping with anxiety is deep breathing and relaxation techniques. This is going to slow down the body's stress response. So that is all I have for today. We're going to next time talk about my favorite topic, and that's plant medicine solutions. So we will do that tomorrow. You all have the best day. Bye.